Hey guys! I went to my midwife appointment today. Yay me! And this time I actually met the third midwife in the practice that I go to. There's 3 midwives and there's one that I haven't had a chance to meet yet. And I finally met her and she's very sweet and I'm glad that I finally got to meet her. And today we talked about labor and when I should call and all that. Of course, standard things like I should call if I start heavily bleeding, or if my bag of water breaks, or I suddenly don't feel the baby moving anymore. Any of those things I should definitely call. But even if my bag of water does break, I'll just call to see what my next step should be. It doesn't necessarily always mean that I need to rush straight to the hospital if everything else seems to be okay. It depends on, you know, what color it is and how everything else is going. And I should also call if my contractions are 5 minutes or less apart and lasting at least a minute for at least an hour. And at that point I should call and let them know, and they'll ask me if I want to go to the hospital or not. It's kind of up to what I want. Unless labor turns out to be way more extreme than I expect it to be or something, I don't plan on going to the hospital right then. I'd rather wait out as much of labor as possible at home, you know, where I can be comfortable and let things progress naturally as long as possible. Today I also had another blood draw. It was a complete blood count. I'm sure it'll be fine. They're just checking to make sure again that my iron is high enough. It was like the least painful blood draw I've ever had. I don't know how the phlebotomist did it, but somehow it was like the tiniest little prick. I don't know. And I also had my group B strep test, which they have you swab yourself. That's kind of uncomfortable and weird and difficult to reach because you actually have to do a vaginal and a rectal swab. I have this big thing called a belly in the way right now, but it's over with, and hopefully that comes back negative, because if the group B strep test comes back positive, I will, what they want is for you to have an antibiotic during labor, and I will do that if I would happen to be positive. Some other things we talked about as far as labor and getting ready for labor. The practice likes their patients to use evening primrose oil to ripen the cervix, and I should start that now. And also they like people to do perineal massage, which is something I've been doing since 34 weeks, so already started that. And we talked about tests and things like for newborns. One thing is the erythromycin that they put on the baby's eyes when they're born. You can, here at least in the state of Ohio, you can decline if you want, especially if you are negatively tested for chlamydia and gonorrhea, which I am. So we're not going to get the eye ointment just because it tends to interfere with baby in those early moments of bonding with mother, and I like to avoid antibiotics in general as much as possible because I think that our society as a whole is way over antibioticed. Way. And one last thing I want to talk about. The midwife that I saw today, she was looking at our birth plan, and one thing we have in our birth plan is that I'd really rather not have a heparin lock, just because I don't want an IV. You know, I want a water birth as long as it's possible, and I don't want to be attached to anything. The midwife changed my mind actually about having a heparin lock because she personally, and she's fairly young, has been at 2 births where the mother delivered the baby but then was delivering the placenta and did not have a heparin lock and had such severe hemorrhaging and blood loss that she passed away, which is terrible and so sad. And I feel so sad that that midwife has seen two deaths that way. That's terribly sad. And because of that personal experience of hers, I will go ahead and have a heparin lock. I think Justin and I talked about it, and obviously I don't want anything put in an IV without my consent or without me noticing or something, because you hear about that happening. But we really trust these midwives, and I don't think they're going to start hooking me up to an IV without there being a really important reason and without my permission, unless emergency. So I am going to go ahead and have the heparin lock just to be safe. You know, I'm not scared that I'm gonna hemorrhage to death, but considering that midwife's personal experience, it seems important. Bye!